whatever we eat can cause us diseases. So my message is watch your microbiome.
Dr. Habiba, I'd like to start with you. What is precision medicine as a start?
Bismillah ar-Rahman ar-Rahim. And first of all, thank you for the invitation and to be part of this panel. Precision medicine or personalized medicine, it's basically reading the information about all your omics. It's your transcriptomic, it's your genomics, it's your microbiome, it's your metabolomic and proteomics. To understand any disease, you need more data. So personalized medicine, basically reading all these information to maximize your effectiveness of treatment and minimize your side effects of a treatment. So basically, it will take into account of the lifestyle of an individual, their genomes or omics data, and also their environment to give you a better outcome of a patient, a better personalized and a precision medicine to help to live longer, to live with a good quality of life.
And in your opinion, what is the biggest impact that precision medicine is going to have on longevity going forward? And I'd love to hear Dr. Nawal's opinion about that as well.
Thank you. Good evening, everyone. So, Dr. Habiba identified precision medicine from a scientific perspective. So, it is an innovative approach in healthcare where you customize the treatment or healthcare based on multiple factors, including genetics or genomics, lifestyle, environment, and many other factors. And the main goal is to customize the healthcare to have an effective treatment, safer treatment, and stay away from one size fits all to more customized healthcare rather than just medicine.
In what fields do you imagine it will create the biggest impact? I know we talked a bit about pharmacogenetics. Do you believe it will have a huge impact there, or in what fields would it have the biggest impact?
So there are many fields or many aspects of precision medicine or individual medicine, including pharmacogenetics. So what is pharmacogenetic? Pharmacogenetics being how there are certain medication that act differently on different individuals. So when we say pharmacogenetics, there are some characteristics of our genes that determine how we metabolize the disease, what is the right dose for us, how our body transport the medications, so, and how we will react to that medicine or that drugs. So you'll be able to know if this medicine is effective, one, is it for this individual, is it safe, so you will minimize the side effect, what is the right dose? What is the right dose for me might be different from you, might be different from Dr. Habiba. Even with the same medications, our response will be different. So this is pharmacogenetics. Currently, pharmacogenetics being applied extensively in cancer treatment. So by identifying the genes of certain tumors, they are able to identify the right chemotherapy. And also, we start to see it, we've been seeing it actually on rare medicine, on rare diseases, because to be able to diagnose rare diseases or certain genetic or metabolic disease, you need that genetic component. But based on this also, you'll be able to determine their medications. But the implication is way more than that. And hopefully we'll see it in the near futures. And maybe we can talk about it later.
Definitely. I'd love to know from you, Dr. Habiba, what are some of the misconceptions Yes. What are some of the misconceptions that exist about precision medicine? I'd love to know from you.
Sure. There are a lot.
Okay.
And being in the Middle East, it's kind of, as you can see, geography, in the geography, the location of the Middle East been a cross map for many years for different tribes, for different cultures as well. If you have people coming from Africa, they won't go to the East Asia, they will cross to the Middle East, or going from East Asia to Western country, they will cross the Middle East. So the Middle East have a unique characterizations, kind of from the culture, from the religion, the family-oriented. Many people, when they hear about the genetic testing, when they take the swab, like there is a lot of companies, they take the swab, they send the samples to the genetic testing companies, and they get the results. These results says what you are at high risk of developing, let's say, type 2 diabetes. They think it's like I'm at high risk, low risk, or medium risk. That means I'm gonna have the disease. So he has like this, if it's low risk, he will say, I will have the disease. No, actually, you can prevent the disease. Doesn't mean you have the gene that you will have it immediately that cause the disease. There is a lot of changes that you can do in your lifestyle. You can prevent it, you can delay it, and also there are kind of a gap in the genetics field. It's, for example, they said the genome project has been completed in 2013. Actually, it's not been completed. They missed a lot of ethnic groups. Basically, the Middle East were not represented in the Human Genome Project in 2013. So we are not Caucasian, we are not African, we are not Asian. As the history, there is a diverse population in our region. So I cannot basically take my genome and align it with the human genome reference and say that this disease is, this variant is causing the disease in Western country, it will be in the UAE. Actually, we did research and we find there is a 20% difference in pathogenicity of these variants between Middle East and Western countries. So this is one element of the genomes, and people, they don't realize, taking the swab and send it to company and I will get the result. Actually, these are not accurate, especially if you are not Caucasian. 97% of the genome is based on Caucasian population.
And hopefully when the genomic project is complete here, we'll have a much fuller look and we'll be able to benefit much more. Dr. Nawal, I want to ask you, what is the relationship between mental health and precision medicine? Because I know this is something you're very passionate about.
Thank you for these questions. So there is a very strong correlation between precision medicine and mental health. Now, in mental health, we all know there is a genetic predisposition. So if you do gene analysis for certain patients, you can see that they are at risk of certain disease, like depression, anxiety, schizophrenia, mental illness. But the same individual, when you look at them, sometimes they don't have those diseases, or that you will identify them at low risk, but they do suffer from certain mental illness. So the mental illness, it is not a pure genetic disease. There is, yes, genetic predisposition, but there are other factors, including lifestyle, environment, stress, so many factors that contribute to the mental health. However, the gene sequence or genetic analysis will help us identify those at risk in our own population, as Dr. Habiba said. So we'll be able to identify those at risk. We'll intervene early and hopefully will prevent certain mental illness and even certain diseases that are well linked with mental health.
Yes.
Exactly. Plus, it will help us plan the future for mental health programs in our countries. There are certain things we can identify it in children, in teenagers. We can intervene early to prevent it.
Yes.
And maybe, Dr. Habiba, you can add to this part.
Well, I'll give you one example with depression. There is a gene cause depression, and it is the same gene causing addiction. If we prevent depression or we take care of this depression disease at young generations, we can avoid the drug addiction when they get older. There is a study in US they did in high school. They found 60% of the kids that developed depression, after they finished the high school, 60% of them, they went into drug addictions. Mental health is very, very important. You might be at high risk of low risk developing diabetes, for example, but your mental health is like, still you are facing issue, then you are triggering the genes to kind of express it, and then you will turn on the gene and you will have a problem. So there is also another aspect. The doctor's physician, when they examine the individual, they examine them in the examination room. They don't examine them outside the examination room about their workplace, about their location, about their living. Maybe he is taking his medication, he is doing everything to manage his disease, but the biomarkers does not show that. The mental health, the place he is living, the kind of the social, his everyday life that is causing the genes that to kind of express it.
And I believe that's where education is going to have to be very important when it comes to healthcare providers, which brings me to the next question, Dr. Nawal, which is what are the barriers that you can expect in applying precision medicine across all the industries in healthcare?
So before we start to apply precision medicine or individual medicine across the board, we have to look at the challenges in the system right now. We have to address those challenges. So number one, when we said training, we need to do proper training for all healthcare workers, not only doctors. Okay, this is one. Two, people need to understand what is the precision medicine. As I said earlier, it is not genetic testing. It is more of an innovative approach to every aspect of your health, genetic, lifestyle, environment. Then there is the factors of, okay, if we are doing a gene sequence or genetic test for our populations, how we will integrate those data with the clinical evidence, how we will integrate it with our lifestyle, how we'll integrate all this information, how we'll manage the huge data. So we need certain rules and regulations and policies, not only training. And training is extremely important because we trained, when we did our medical school, we trained how to take care of patient in a traditional way. Now, things are completely different. Maybe, Doctora, you can. Also, AI should be integrated as part of the precision medicine.
Definitely.
Yeah, well, again, personalized medicine is driven by data, basically, and AI for early detection, risk, disease risk, and these modeling kind of exercise that we do to calculate the score of risk diseases. These are very important. But also, like Dr. Nawal mentioned, there should be policies, and also to improve these policies and update them as the technology is rapidly changing. 10 years ago, it will take like years and years to complete one sequence of a human. Now we can do it in less than 2 days. So, and also the data, how we going to kind of balance between the innovation and patient data and protect their data. Data sharing, we need to have policies with data sharing, the collaboration between physicians, between scientists, the networking, and also the international collaboration. There is a lot of consortium. The more we share the data, the more we know about the disease, the more we're gonna put a plan for prevention, for management, and also to support the public in the strategies, and also planning for, any, for example, pandemics, any of outbreak.
Thank you for that. And Dr. Nawal, we talked a little bit with Dr. Habiba and yourself about the cultural perception as well. I think there's a lot of people who would not want to know if they're at high risk of certain diseases. And do you believe that would be a struggle educating the public? I'd love to hear from either of you.
I think health awareness is extremely important, because we'll not be able to apply the precision medicine without buying in from the public. And actually, there is a huge role for precision medicine when it comes to population health. So, for example, people think, okay, God will that I'm going to get the following diseases. Why you want me to learn about it when I am 20 years old? I don't want to know that I will develop Alzheimer or I will get a cancer. Actually, even if you don't know, as a health, it's their right, by the way. If they don't want to know, that's fine. But as a healthcare system, you need to know your population at risk of what disease. You need to plan it. You need to have the right research and development to develop the right treatments, get the right tools to diagnose it as early as possible. So it is not a matter of knowing, it is planning the screening, plan the prevention. I mean, even if you are at risk of cancer or Alzheimer or even autoimmune disease or even rare diseases, there is a preventive measure, there is a screening, there is a way to minimize the negative impact on your health. So they have to be aware this is extremely important. It is not a matter of, no, I don't want to know this fact.
Yeah, definitely, because that's the core of healthcare. It's to highlight where there's areas of improvement so that they can have better quality of life.
And I think the UAE is doing a great, and there is a lot of initiatives from healthcare sectors that they are involving academia with industry, with healthcare. So part of, as I'm from academia, we do give awareness and education for our next generations. Basically, your medical record is your family tree. You go back home and you see your family and the diseases in your that is high risk or low risk or medium risk. But how you can educate your family member, telling them about what are there and the technology and the genomics, what is the benefit. Yes, I mean, for my personal experience, my sister, she doesn't want to know the diseases that she is at high risk, but I do, and I want to know it now to prevent it. But as an ethical issue as well, if I'm going to test for certain genetic diseases, I have to inform the family. So you need to know how you can educate them and to see the benefit of these kind of testing. And what we're going to do, there is kind of initiative from the Department of Health to do genetic counseling, for example, the education or genome subjects in high school and also in grade 4 or 5 at early age, knowing the color, the color of the eyes, and go and check your parents. These are kind of small aspects of genetics, and they will understand later.
Amazing. This has been very rich. For the last question that I have for both of you today, Dr. Nawal, what would be your take-home message, really, about precision medicine and your recommendations for the future?
My take-home message, I think we are at the earlier stage of applying precision medicine. Everyone should be aware about what is precision medicine, what is the implications, what is the challenges. We need to work together at different sectors and collaborate to be able to apply the precision medicine or individual medicine, or some people they even said we should call it a precision health because it impacts all aspects of your life.
I love that. Dr. Habiba, do you have something you'd like to highlight?
My take-home message would be, to be honest with you, whatever we eat can cause us diseases. So my message is watch your microbiome. It's very important to understand that diseases is a process of aging, but we can prevent a lot of diseases by living a very good quality of life, by watching what we are eating. We are doctors for ourselves, but we know this kind of food will cause me a problem, can cause me, like fast food will give you, having side effects, or you're gonna have diseases or type 2 diabetes or hypertension. You need to avoid it. You need to practice a very healthy lifestyle.
Thank you so much for that. I really, really appreciate the discussion with both of you.
Thank you.
Thank you.